This week, we'll be discussing how social welfare services are delivered. As a reminder from earlier in the semester, there's different types of social welfare benefits. The first are direct or monetary benefits, which include Social Security and TANF, or Temporary Assistance for Needy Families. These are welfare checks. So these are checks that people receive in the mail. There's also in-kind benefits or vouchers, where people receive goods. These include public housing apartments, so they physically have an apartment, Section 8 vouchers, which allows individuals to get apartments, and also WIC food supplements, so individuals receive coupons through WIC to get specific types of food, such as a coupon for bread, coupon for a gallon of milk, etc. The last type of social welfare benefit, which we'll be talking about throughout the rest of this lecture, are services. So they actually receive assistance from someone. So this might include Medicaid. So Medicaid, Medicare is health insurance. So they're physically receiving healthcare services from a physician or other healthcare provider. Foster care services. So individuals in foster care receive assistance in housing, aging out of the foster care system. There's mental health case management. So this is where case managers are working regularly with an individual who has mental illness, connecting them with a variety of assistance. So these are services. So individuals are physically being delivered assistance from someone in particular. So the question is, who actually provides these services? When we look at foster care case management and mental health case management, who is actually delivering the case management? So it's actually a combination of help from the public or the government. So when we use the word public, we mean government, and private businesses. So private businesses include both nonprofit and for-profit businesses. So the first, when we look at public organizations, so public is under the government control. So when you look at the Department of Social Services, the Department of Health, Department of Education, Veterans Affairs, these are directly under the government control. So the government has 100% control over them. They're completely funded by the government. And there's also, they're being provided at various levels of government. So for example, there's a Department of Health at the federal government level, at the state level, and at the local government level. So all of these levels of government have different social services that they are providing. However, with public organizations, most of the social welfare programs they're providing tend to be direct social welfare programs, such as Social Security and TANF. So it's a lot easier for the government to mail welfare checks than it is to actually provide case management. So a lot of that case management tends to be done by private organizations. So private organizations are outside of the direct control of the government. These can either be nonprofit or for-profit. The only difference between nonprofits and for-profits is how they use their excess money. So if an organization brings in more money than they spend, they have a surplus, they have extra money. So in a for-profit business, that money goes back to the owners of the company. In a nonprofit, it cannot go back to the owners. It has to be used to fulfill their mission. So if you're a nonprofit child welfare agency, if you have extra money because the services that you provided didn't cost as much as you expected, so you have extra money, you would have to put that back into child welfare. So maybe you hire an extra case manager, maybe you have extra housing for an individual, but it's the only difference between the two is how they spend their excess money. So nonprofits and for-profits do the exact same thing, just spend their money a little differently. The other thing to keep in mind is private organizations are really the historical foundation of social welfare services. So think about those charity organization societies, those friendly visitors who went into people's homes. The first orphanages were run by private organizations. Homeless shelters, soup kitchens, almshouses. These were all run by either churches or community agencies. Churches were really the first private agencies, but there's also a variety of community agencies that really stepped up to assist people in need. And private organizations have been around far longer in social welfare services than the government, than the public organizations. So that's where we really see our foundation of social welfare. The other thing is, And these organizations, a lot of times, are more likely the ones who are actually providing the social welfare services. So when someone is going into a home and providing foster care case management, a lot of times that is a private individual who's being paid by the government. So that process is called privatization. So the definition of privatization is the transfer of ownership, property, or business from the government to the private sector. So what does that definition actually mean? So what it means is that the government has money, the government collects money in taxes, and then the government pays private agencies to provide certain services. So the government is providing the funding and the regulations to the private agency to then provide those services. So different examples of privatization, as I kind of mentioned before, foster care case management. So a lot of foster care case management is provided by private businesses. So in the state of Kansas, for example, the Department of Children and Families actually investigate child abuse claims, and they determine whether or not a child is safe to stay in their home. But if a child is deemed not safe to stay in the home and they're placed in foster care, then someone from a private agency is the one who's actually stepping in to provide the foster care case management on behalf of the government. So St. Francis Ministries, located in Manhattan, is one organization. It's a nonprofit that provides a lot of foster care case management throughout the state of Kansas, but they provide other assistance options too. So foster care case management, mental health case management is another. Charter schools are an example of privatization. So charter schools are private schools. They are not regulated by the government, but they do receive money from the government to provide education for students. So charter schools do not charge tuition. Instead, they receive money from the government to kind of act as a kind of like a pseudo public school. So they're public in the sense that the government is paying and they have to accept all kids, but they're private in the sense that the government doesn't provide them with as many regulations and restrictions as they do typical public schools. So here is, again, just another example. Another way that the government privatizes social services is through Medicaid. So Medicaid is insurance for low-income individuals. And with Medicaid, the government, so the state of Kansas, determines who's eligible to receive Medicaid. And someone submits an application and the government says, okay, you can receive Medicaid. The actual way that they receive the Medicaid is through a private health insurance company. Okay. So if you have a private health, and if you pay for your health insurance through Aetna or United, they also have Medicaid options. So you can sign up for one of their Medicaid plans if you're deemed eligible to receive Medicaid. So the government determines someone's eligible, and then they pay private businesses to provide health insurance for the recipients. So the government tends to pay them per person. So if you sign up for, I don't know the exact cost, but if you sign up for Aetna would get paid $100 a month to provide you with health insurance. And then Aetna is the health insurance provider and then pays the physicians when you have to go to the doctor. The thing to keep in mind is that in Kansas, these are the three health insurance companies that provide Medicaid. So it's Aetna, Sunflower Health Plan, and then United. Sunflower Health Plan is actually operated by a company called Centene. And these are the three. So if you sign up for Medicaid, you have three options for which Medicaid plan you want to enroll in. So there's, as you can imagine, with any system, there's pros and cons of privatization. So the trend over the past few decades has been moving towards more privatization. So now over half the states privatize Medicaid. Foster care has become more and more privatized. We've seen an increase in private prisons, and charter schools has been on the rise. So why is it that we engage in privatization? Really the top reason that a lot of people see privatization as a positive is a lot of times they've been shown to be more cost effective. So in a lot of situations, they can provide Medicaid more cheaply than if the government provided Medicaid. There's been some questions on how much more cost effective they are, but when Kansas switched to using private companies to provide Medicaid, they did have some cost savings, not as much as they expected, but they did have some cost savings. And the reason that there's cost savings is that there's competition, and these private businesses are incentivized to make cost savings. So if you look at Aetna as an example, so Aetna is a private company. It's a for-profit. So any extra profits that Aetna has, they get to keep. So if the government pays them, let's say I'm on Aetna's Medicaid plan. So if the government pays them $100 per month for me to be on their Medicaid plan, Aetna is incentivized to reduce the amount that they actually have to pay for my health insurance. So there is a reading for class, a short reading for class this week that kind of lays out different ways that these private health insurance companies are able to reduce the cost of health insurance to make it cheaper. But they have, they are incentivized to innovate and make improvements in the system to make it cheaper. Because if Aetna only pays $90 for me to go to the doctor this month, when it would have cost the government $100, Aetna gets to keep that extra $10. And then it goes to the workers of Aetna and it goes to the owners. So these kind of incentives within the system for private businesses to make things more cost effective because they get the extra money. The other thing is that another reason it's kind of more cost effective is that it's free from political influence. So the government, it's not regulated as much by the government. It doesn't have all this government bureaucracy and the rules that the government sets forth. With charter schools, they don't have teacher unions at charter schools. And, as with anything, there's pros and cons. So teacher unions have a lot of pros, but they also have some cons that they do kind of increase the cost of education because teachers as part of a union get paid more. So charter schools don't have to abide by all of the same rules that regular public schools do. They also don't have the same standardized testing requirements. They have some standardized testing requirements, but not the same as regular public schools. So again, they don't have all of that bureaucracy and the administrative costs that are really present in a lot of the public service sector. With all of that being said, there are cons as well. There are certainly cons of privatization. The first is that, if companies are incentivized to reduce costs to earn a profit, then in many ways they are kind of putting public welfare at the extent of the bottom line. So if they're trying to make more money, sometimes they are incentivized to reduce quality services because higher quality is going to be more expensive. This is extremely more problematic when individuals do not have a choice in their provider. So for example, in Medicaid in the state of Kansas, there are 3 providers of Medicaid. In each Medicaid provider, so it's Aetna, Sunflower, and then United, they want as many people on their plan as possible because they earn money for every additional person that they have. So if they have low quality, if Aetna's Medicaid plan is really low quality, people aren't going to choose it and they'll choose United. So in a way, having that competition built in with multiple providers helps to maintain the quality of the services. However, when we think about private prisons, do people have a choice on which prison they go to? No, they don't. They have to go to this prison that they are told that they're going to go to. So that's why it becomes more problematic. Without having a choice, there's no competition to ensure there's quality of services. So private prisons can reduce the quality of services because prisoners have no other option. They can't just go to the prison down the road. So it's not as problematic when there's multiple service providers. But in certain industries, in foster care case management, you can't really choose your foster care case manager. You can't switch from one company to the next. Private prisons is like that. Charter schools is not. So charter schools, there's multiple options. So there's a charter. Typically, if you have a charter school option, you're most likely going to be in an urban area. So you might have multiple charter schools that you can pick from in addition to your regular public school option. So because you have multiple options and each charter school is trying to get as many students as possible, they have to maintain more high quality services compared to like a private prison. One con of privatization is what's known as preferential selection or creaming. So this is the idea that private agencies will only select individuals who are going to be the least costly to serve. So, for example, at charter schools have received some flack for this. There have been more regulations saying that charter schools can't deny certain kids, but charter schools have been kind of called out for not always selecting kids who might need a little extra help. So charter schools serve a lower percent of kids who are English language learners and who have disabilities. They're more expensive. So in some sense, schools have more choice over which kids they select, and they might choose the kids that are just the least costly to serve because it's more beneficial for their profit. However, a lot of states do require charter schools to select any student, so they don't always have the choice. But there has been some questions of like private prisons selecting individuals who have less security needs, so they don't have to hire as many security guards, individuals who are more likely to have a misdemeanor versus a felony. So they have been criticized for some creaming. So creaming is where you take things off the top. So you take the best people and you make the others go to the public option or one of the other providers. Additionally, there's not a lot of as much government oversight when it comes to the private companies when they're providing the services. It's not to say that there is no government oversight. There are regulations that they have to follow. For example, I worked at a child welfare agency, and the child welfare agency provided foster care case management. And for so this was a nonprofit, and because they were paid by the government. So again, with privatization, this was in the state of Missouri. The state of Missouri paid the agency that I worked at to provide foster care case management. And with the foster care case management, they had very specific rules that they had to follow. So the organization, despite being a private organization, they had to go visit the foster kids every so often. They had to spend so much time a month with them. You know, the kids there were certain regulations for the foster homes that they had to abide by. So there's still regulations, but when you have another layer of separation between the public and the private, there's not going to be complete oversight between the services that are being provided. So we're using public funds, we're using our taxpayer dollars to provide services, but we don't have direct control over the services that are being provided. Again, when we think about the idea that public funds are going to private businesses, some people might just have ethical opposition to it, because our public dollars are going to private businesses. And if for-profit businesses, that money might be used to pay the CEO, a large salary or a large bonus. So do we really want to be spending our public dollars in that way? So those are just things to ask yourself. So with privatization, there's pros and cons on either side. And I would definitely say we're moving towards increased privatization rather than decreased privatization. So more and more social services are being contracted out to private businesses. So in class this week, we have a series of readings. There's a video, podcast to listen to that looks at different examples of privatized social services. So the first is looking at private prisons. So you're going to watch a video on some of the drawbacks of private prisons. You're going to read more about Medicaid, the pros and cons of having privatized Medicaid, and then you're going to learn more about charter schools.